Seniors, please pay attention. This could save your life. Nearly 60% of all cancer cases occur in people over the age of 65. And yet, many seniors miss the early warning signs, not because they aren't paying attention, but because these signs often seem so normal. A bit of fatigue? Occasional bloating? A tiny change in your skin? Here's the terrifying truth. Many of these seemingly harmless symptoms can be the early whispers of cancer, long before the body starts to scream. Most people think, "Oh, I'm just getting older." But what if you're not just aging? When cancer is caught early, the survival rate can be over 80%. But if you wait too long, that number can plummet to below 20%. That's a heartbreaking gap. And the difference between those numbers is often just awareness. In this video, you're going to discover 8 silent symptoms that many people over 60 completely overlook. Symptoms that may appear normal, but could be a red flag your body is trying to wave. Don't ignore your body. Don't assume it's just aging. Because when it comes to cancer, your best weapon is early detection. Make sure to watch until the end, where we'll also reveal 3 powerful foods that have been shown to help prevent cancer in seniors. Your health is worth 10 minutes of your time. Let's get started. Before we dive into the first warning sign, let me ask you this. Where are you watching this from? Are you relaxing at home? On your morning walk? Or maybe sharing a moment with your loved ones? Type your city or country in the comments below. We love seeing how far this community of smart, health-conscious seniors reaches around the world. And while you're here, if you care about staying strong, healthy, and independent as you age, don't forget to hit the like button. It helps more seniors find this life-saving information. Also, subscribe and turn on the notification bell. We post weekly videos to help you live longer, move better, and feel more energetic every single day. This isn't just another health channel. It's a community. And your voice matters here. So go ahead, drop a comment, hit like, and make sure you're subscribed. Now, let's uncover the first silent symptom that could be hiding something serious. Warning sign number 1, persistent heartburn, a silent signal from within. Many people over 60 think heartburn is just a normal part of aging or a weak stomach. But if you experience heartburn frequently, especially at night or after regular meals, do not ignore it. This could be one of the earliest signs of esophageal or stomach cancer, both of which are often diagnosed in later stages. Pay close attention if you also notice persistent hoarseness without a clear cause, a feeling of food getting stuck when swallowing, the need to take antacid medication daily to ease discomfort. These symptoms may be caused by chronic inflammation in the esophagus, which over time can lead to a condition known as Barrett's esophagus, a known precancerous stage of esophageal cancer. What is Barrett's esophagus? It occurs when the lining of your esophagus changes after prolonged exposure to stomach acid. While not everyone with Barrett's develops cancer, the risk increases significantly if left unchecked and untreated. What you need to remember: if you have persistent heartburn, don't respond to medication, or experience any unusual changes in your chest or throat, see a doctor promptly. A simple endoscopy can detect hidden issues before they become life-threatening. Don't take frequent heartburn lightly. It may be your body's silent cry for help. Now, let's move on to cancer warning sign number 2, a symptom that's often overlooked but can be a serious red flag. Sign number 2, eye pain or vision changes, could be a sign of a hidden tumor. Many people over 60 assume that blurry vision, eye pain, or flashes of light are just normal signs of aging. But if you suddenly start experiencing blurred vision in one eye or feel a dull ache behind the eye, it's time to pay attention. These symptoms could be linked to eye cancer, especially a rare but dangerous form called ocular melanoma. In some cases, they may also indicate cancer that has spread to the eye, particularly from the breast or lungs. Watch out for these warning signs. Persistent eye pain that doesn't go away with rest. Sudden blurred vision in one eye. Seeing flashes of light or flickering, even in the dark. A dull ache behind the eye, especially when moving it. These changes are not typical signs of age-related vision decline. They are unusual warning signs that many people ignore. Remember, a tumor in the eye can damage the optic nerve, leading to vision loss or even life-threatening complications if it spreads to other parts of the body. So if you notice any of these symptoms, don't wait. A simple eye exam could catch cancer early and help preserve your vision and your life. Now, let's move on to cancer warning sign number 3, something we often ignore but it can be a critical red flag: abnormal stool changes. Sign number 3, abnormal stool, a possible indicator of colon, pancreatic, or liver cancer. Most of us don't think twice about our bowel movements, but when there are sudden changes in shape, color, or frequency, it could be more than just an upset stomach. These changes might be warning signs of serious conditions like colon cancer, pancreatic cancer, or liver cancer. Here are the signs to look out for. Number 1. Clay-colored stool. A light, almost grayish stool can indicate a blocked bile duct, which is a possible sign of liver or gallbladder cancer. Number 2. Black or tarry stool. This could be a sign of gastrointestinal bleeding, often from a stomach ulcer or upper GI tract cancer. It may also occur due to cancer in the colon. Number 3. Flat or very small stool. If your stool becomes narrow and ribbon-like, it could mean that a tumor is pressing against the colon, blocking the passage and causing changes in your bowel movements. Number 4. Feeling of incomplete bowel movements. If you feel the urge to go but can't fully empty your bowels, or if you experience bloating and discomfort after a bowel movement, this may point to blockages or tumors affecting the colon. Why it matters: these changes are not normal and should never be ignored, especially if they last for more than a few days. They can indicate the presence of a tumor or other serious conditions affecting your digestive system. So, if you notice any of these changes, especially if they're persistent or worsen over time, it's important to get checked out. Early detection can make a world of difference in treatment outcomes. Now, let's dive into cancer warning sign number 4, unusual skin changes. Sign number 4, unusual skin changes, a possible sign of skin or internal cancer. Your skin can be a reflection of your overall health, and when you notice dryness, itching, discoloration, thickening, or wounds that don't heal, it's essential to pay attention. These changes can be a warning sign of either skin cancer or internal cancers affecting organs like the stomach or blood. Here are the changes to be aware of. Number 1. Dark, thick patches of skin, acanthosis nigricans. If you notice dark, velvety patches of skin appearing around your neck or armpits, it could be a sign of insulin resistance, often linked to stomach cancer. This skin condition should not be ignored. Number 2. Unexplained bruising. If you suddenly start developing bruises without any clear cause, this could signal a blood disorder such as leukemia or other forms of blood cancer. While bruising can happen from minor injuries, unexplained bruising, especially when frequent, should be investigated. Number 3. Persistent dryness or itching. If your skin becomes unusually dry, itchy, or irritated for an extended period, it may indicate underlying health conditions, including internal cancers, particularly those affecting the liver or kidneys. When paired with other symptoms, this could be a cause for concern. Number 4. Wounds that don't heal. Any wound that takes longer to heal than usual could be a sign of skin cancer or an indicator of diabetes or immune system problems. If your cuts, scratches, or sores are resistant to healing, it's crucial to seek medical advice. Why it matters: your skin can often act as an early warning system for serious health issues. Any significant skin change or abnormal appearance should be examined by a healthcare professional, particularly if you notice other symptoms alongside it. Now, let's explore cancer warning sign number 5, night sweats. Sign number 5, excessive night sweats, a potential warning for lymphoma or leukemia. Waking up drenched in sweat despite a cool room? Night sweats that occur frequently and intensely, without the presence of fever, can be a warning sign of lymphoma or leukemia, both forms of blood cancer. What's the difference? Unlike regular sweating that's caused by temperature changes or physical activity, night sweats associated with these cancers occur repeatedly and are often severe, with no apparent reason. You might find yourself waking up in a wet bed even though the room is cool and you haven't had any physical exertion. Other things to watch out for. Number 1. Frequent episodes. If you're sweating heavily night after night, without an obvious cause, this could be a red flag. Number 2. No fever. Unlike sweating caused by illness, which is often accompanied by fever, night sweats from lymphoma or leukemia occur without a fever. If you're sweating excessively but don't feel feverish, it's important to take notice. Number 3. Unexplained weight loss. If you're also losing weight without trying, it's crucial to seek medical attention. Why it's important. Night sweats caused by lymphoma or leukemia are typically persistent and unexplained. They can be accompanied by other symptoms like swollen lymph nodes or unexplained fatigue. While sweating is common, if it happens regularly without clear causes, it's worth discussing with a healthcare professional. Let's now dive into cancer warning sign number 6, unexplained bone pain. Sign number 6, deep, unexplained bone or joint pain, a potential sign of metastatic cancer. If you experience deep pain in your bones or joints that doesn't seem to have a clear cause and doesn't respond to painkillers, it could be a warning sign that cancer has spread to your bones. This is especially common with cancers such as prostate cancer, pancreatic cancer, and others that are known to metastasize, spread, to the bones. What to watch for? Number 1. Pain that doesn't go away. The pain is persistent, lasting for weeks or even months without a clear injury or explanation. Number 2. Pain that worsens at night. Bone pain caused by cancer often gets worse at night or when you're resting, making it difficult to sleep. Number 3. Pain that doesn't respond to usual pain relievers. Over-the-counter painkillers may not help, and the pain may continue to intensify despite treatment. Why it's concerning. Bone pain that doesn't seem to go away and is getting worse over time could indicate that cancer has spread to the bones. This condition is called bone metastasis, and it occurs when cancer cells from another part of the body travel through the bloodstream and lodge in the bones. Other symptoms to keep an eye on. Swelling or tenderness around the painful area. Unexplained fatigue or weight loss. Difficulty moving or stiffness in the affected joint. If you're experiencing bone or joint pain that fits these descriptions, it's important to seek medical attention immediately to rule out any serious underlying causes. Let's now look into cancer warning sign number 7, changes in nails or fingertips. Sign number 7, changes in nails or fingertips, a possible indicator of serious health issues. If you notice changes in your nails or fingertips, such as thickening, discoloration, or abnormal growth patterns, these can be important warning signs of potential cancer, particularly lung cancer or digestive system cancers. What to watch for? Number 1. Clubbing of the fingers, also known as drumstick fingers. This occurs when the fingertips become enlarged and the nails curve downwards. This could be related to lung cancer, particularly in cases where cancer affects the lungs or digestive system. Number 2. Dark streaks or vertical lines on the nails. If you notice dark lines or stripes running vertically along your nails, it could be a sign of subungual melanoma, a rare form of skin cancer that develops beneath the nails. Number 3. Brittle nails or nails with unusual grooves, pits, or dents, thinning, splitting, or breaking of nails, or nails that develop deep grooves or indentations, might point to a systemic health issue or be associated with cancer affecting the bones or connective tissue. Why it's concerning. These unusual changes in your nails or fingertips aren't just signs of cosmetic issues. They may indicate more serious underlying health problems, including types of cancer, especially if the changes are persistent or worsening. Other symptoms to keep an eye on. Pain in the fingers or nails, in the case of melanoma under the nails. Changes in color or texture of the skin around the nails that seem unusual. Swelling or sensitivity near the nail area, especially when touching. If you observe any of these symptoms, it's important to consult a healthcare professional immediately to rule out potential cancers or other serious health conditions. Let's now dive into cancer warning sign number 8, a general feeling of not being right. Sign number 8, a persistent sense of being off, a subtle but crucial indicator. Do you often feel tired, low on energy, or unsettled for no apparent reason? This vague sense of discomfort, when you feel something's just not right but can't put your finger on it, could be an early warning sign of cancer, even before other symptoms arise. What to watch for? Number 1. Unexplained fatigue. Feeling consistently exhausted without a clear cause can signal something more serious. It's important to listen to your body, as many people discover they have cancer due to feeling off, even without specific symptoms. Number 2. Persistent sense of being unwell. If you feel like you're always on the edge of something being wrong, restlessness, anxiety, or just a general feeling of unease, it could be a sign that your body is trying to tell you something. Number 3. Mental fog or difficulty concentrating. Along with physical fatigue, mental fog or lack of clarity in thinking can often accompany early stages of cancer, especially when it impacts organs like the brain, lungs, or digestive system. What to be alert for? This vague feeling isn't something to brush off. While it can be caused by many non-serious conditions, it's often how many people discover they have cancer, as they pay attention to their body's signals even when they don't experience specific, noticeable symptoms. Other signs to look out for: low-grade fever that won't go away, chills or feeling unusually cold, a lingering sore throat that doesn't resolve, unexplained weight loss or changes in appetite. If this vague, persistent feeling continues for weeks or becomes more noticeable, don't hesitate to see a healthcare provider for further evaluation. Next, let's explore 3 types of foods that can help reduce cancer risk. A healthy diet is a key factor in enhancing health and lowering the risk of cancer. Below are 3 simple yet effective foods you can add to your daily diet to protect your body from cancer risk. Number 1. Broccoli. The cancer-fighting hero. Broccoli is one of the most powerful foods in fighting cancer. It contains a compound called sulforaphane, which has anti-inflammatory properties and helps protect cells from DNA damage. Protecting DNA is a crucial factor in preventing cancer, as DNA damage is one of the main causes of cancer cell development. Best way to prepare. To preserve all the valuable nutrients, the best way to cook broccoli is by steaming it for 3 minutes. This method helps retain the vitamins and cancer-fighting compounds without losing nutritional value. Number 2. Tomatoes. Boosting power with lycopene. Tomatoes are an excellent source of lycopene, a powerful antioxidant that helps prevent cancer development, particularly breast and prostate cancers. Lycopene helps reduce cell damage and enhances the body's immune system. Preparation tip: cooking tomatoes releases more lycopene, so feel free to add them to soups, stews, or stir-fries. Number 3. Garlic. Natural anti-inflammatory. Cancer-fighting garlic contains a compound called allicin, which has anti-inflammatory and antibacterial properties. Not only does it boost the immune system, but it also helps reduce the risk of cancer, especially stomach and colon cancers. How to use: garlic can be used raw in salads or added to stir-fries and roasted dishes to enhance flavor and nutritional value. Incorporating these foods into your daily diet will help strengthen your body's cancer-fighting ability, while also providing essential nutrients for long-term health. Share this information with your friends and family to help everyone become more aware of foods that reduce the risk of cancer. Adding these foods to your daily diet is a simple yet effective way to protect your health. Don't forget to like and subscribe to stay updated with more useful videos that can help you and your family maintain good health.